I ask to speak as if in morning business.
Without objection.
Thank you, Mr. President. Mr. President, I come to the floor today because the President of the United States earlier today had a town hall meeting to talk about the new health care law, the law that he has promoted and talked about and has been a major point of discussion, debate, and then vote in this chamber over the last year. And I come as someone who has practiced medicine in Casper, Wyoming since 1983, as an orthopedic surgeon taking care of families all around the state of Wyoming, working on prevention, working on early detection of medical problems through the program called the Wyoming Health Fairs. And I come to the floor today having watched and read the comments by the President to take a look at some of those and see what the American people heard from the President and what I see as my doctor's second opinion about this health care law. It is a law, Mr. President, that I believe is bad for patients, bad for payers, the American taxpayers, and bad for our medical providers, our nurses and our doctors who take care of those patients. And like most Americans, I believe this is going to unfortunately raise the cost of care for American families and lower the availability and the quality of that care. So I'd like, Mr. President, to just point out a few of the things that the President of the United States said today. And I want to do that from my perspective as someone who goes home to Wyoming on weekends, visits with patients, and just a few minutes ago, earlier today, in my Senate office, visited with a patient, someone that I had operated on, done surgery on her knee about 10 years ago. And one of the things that the President said today, he talked about Medicare Advantage. Medicare Advantage, in my opinion, is a program that has a lot of advantages, and that's why 1 out of 4 Americans on Medicare sign up for Medicare Advantage. It deals with preventive care. It deals with coordinating care, so it's coordinated in a way that they get better care. Well, the President said Medicare Advantage benefits will not change. He said, first and foremost, I'm quoting the President, first and foremost, what you need to know, he said, is that the guaranteed Medicare benefits that you've earned, he said, will not change regardless of whether you receive them through Medicare or Medicare Advantage. Well, seniors who know a lot about Medicare Advantage know that that's just not the case. And you don't have to go very far back to find it. Yesterday's Wall Street Journal talking about Medicare and specifically Medicare Advantage. And I'll just quote from this article, Mr. President. It says, dozens of Medicare Advantage providers, the insurance companies that help with the Medicare Advantage, plan to cut back vision, dental, and prescription benefits. Plan to cut back vision, dental, and prescription benefits. Some plans, it says, are eliminating free teeth cleanings and gym memberships and raising fees for hearing aids, for eyeglasses, and for emergency room visits. Well, wait a second. The President of the United States said Medicare Advantage's benefits will not change. This says that there are a couple of reasons why he's wrong. One of the reasons is that the rate the government will pay private insurers to run the plan is frozen. It's frozen at in 2011 at the 2010 levels, while medical costs are expected to increase an average of at least 6%. You know, Mr. President, I thought we went into this whole health care debate and discussion the idea to get the costs down. But now what we're seeing is, nope, costs are going to go up in spite of or perhaps because of this legislation. Such price increases, it says, and benefit cuts will help the companies recoup the difference of the losses. So Medicare Advantage benefits are certainly going to change, Mr. President, and they're going to change in a way that is detrimental to the seniors of the country, regardless of what the President said today in his town hall meeting. Well, then he went on and he said that the health bill, quote, will actually reduce the deficit, reduce costs. That's what the President said today at his town hall meeting in Maryland. It's astonishing because I don't believe any person in this chamber believes that. I don't think anyone listening at home to the town hall meeting believed it. And the President's chief actuary doesn't believe it. Actually, the chief actuary a month or so after the bill was passed, after it was signed into law, came back, released projections that said that the health care overhaul will likely cost about $115 billion more in spending over the next 10 years than the original cost projections, taking the cost, the total estimated cost, to above $1 trillion. The President says this will actually reduce the deficit and reduce costs. This is at a time of record deficits when the American people are very concerned about the deficits and the incredible debt. Now, from the transcript of the President's speech, as he goes through it, he says, and finally, he said, we're going to reduce by half the amount of waste, fraud, and abuse in the Medicare system. That is an admirable goal, Mr. President. There is significant waste, fraud, and abuse in the Medicare system. Say, how much waste, fraud, and abuse is there? You know, I'm not sure that anyone knows for sure exactly how much it is, but the Associated Press, with a lot of study, has said it's about $47 billion a year. $47 billion a year. Well, what are the budget people who looked at this health care law? What do they say? How good is it going to be? How effective? The President's talking about cutting it in half from $47 billion. If you could save $23 billion a year, I mean, that's an accomplishment. Well, the Congressional Budget Office estimated that with Medicare, Medicaid, and the Children's Health Program, with the integrity provisions, those are the things aimed at waste and fraud and abuse, they are thinking that over the next 4 years, they'll save about $2.2 billion, and over the next total of 10 years, they'll save almost $7 billion. Now, savings are good, but they're going to save $7 billion over 10 years when, according to the Associated Press, we're losing about almost $500 billion over 10 years to waste, fraud, and abuse. So the savings, according to the Congressional Budget Office, are minuscule. But yet the President today, talking to this crowd, said we're going to reduce by half. So I don't know, maybe he's thinking about introducing a new law, because it's sure not into the health care bill that was signed into law and passed with 60 votes in this body. Well, after the President went through all of these, he then said, so that's what the law does. He said, now, having said that, there are some of the folks who are against health reform in Congress. I don't think anybody's actually against health reform, Mr. President, but I'll tell you, there are a lot of people who are against this bill. He said, in fact, you have an entire party out there that's running on a platform of repeal. It's not a party. It's 60% of the American people are saying we should repeal and replace this health care law. But so the President went and had this meeting, but there are a lot of things that the President of the United States did not tell the American people. And it are those things, that's the reason that 60% of the American people are opposed to this new law. He didn't mention that Medicare cuts will be $550 billion. And those are cuts to hospitals, cuts to nursing homes, cuts to home health agencies, cuts to hospice to help people in the final days and hours of their lives. Didn't mention that at all. Didn't mention that the new Medicare director, someone he's recently named, loves the British healthcare system and says we're going to need to ration care. He is planning to ration care, the new director of Medicare. Didn't see that mentioned to the seniors today. Didn't see him mention the fact that up to $18 million has been spent on a mailer about the new health care law, that many have referred to this as propaganda because it fails to really clearly and honestly express what is going to happen to people on Medicare as they cut $550 billion from their health care over the next years. Don't think he mentioned that 1 in 6 hospitals are going to find that they're in the red living under the new system. That's what the chief actuary has said. Don't think he mentioned the $25 million plan that was mentioned yesterday in the New York Times. White House and allies set to build up health law, and Democrats who backed it. It says the president and his allies concerned about deep skepticism over his landmark health care overhaul are orchestrating an elaborate campaign to sell the public on the law, including, Mr. President, a new tax-exempt group that will spend millions of dollars on advertising to beat back attacks on the measure and the Democrats who voted for it. Well, that's what we hear. We now have a health care law that, as Nancy Pelosi said, you have to pass it before you get to find out what's in it. And the American people are finding out what's in it, and week after week they're finding some new unintended consequence, something that they don't want, something that they don't think is good for them. And that's why week after week, Mr. President, I come back to the floor to talk about a health care law that failed to pay for doctors who take care of patients, failed to pay to train doctors, and failed to deal with lawsuit abuse. Now, it did have money in for a lot of new IRS agents to go ahead and try to enforce the law that's mandating everyone to buy insurance. But I think if you talk to people in any of our home states, they're going to say, you know, we need more new doctors. We don't need more IRS agents. And that's why, Mr. President, I come to the floor with my second opinion, and an opinion that says it's time to repeal the legislation and replace it with legislation that is really a health care system and program that is patient-centered, that will allow Americans to buy insurance across state lines, that will provide the same tax relief for individuals who buy their health insurance personally. They would get the same tax relief that the big companies get, that would provide individual incentives, such as premium breaks to encourage healthy behavior, that would deal with lawsuit abuse, and that would allow small businesses to join together to provide less expensive health insurance for the employees. And that's why today I offer my second opinion, that it is time to repeal and replace this bill and get patient-centered care for the American people. Thank you, Mr. President. I yield the floor.